Hello, everyone. Welcome back to another episode of The Crossroads. I am your host, Rashida Green. So, this episode was pre-recorded. I recorded with Doniel last week, the 15th, which is the same day that I recorded the previous episode as well. But we are still having the discussion about the coronavirus, and I want to make sure that I'm giving you up-to-date information, but also letting you know that what you're hearing isn't with the current information. So for those who may not be aware or are a little burned out or too busy running after your children, and I understand, several states at this point, the governors of several states have either given people instruction about quarantining, which isn't really an actual quarantine. I'll just call it the Q word because I know it's kind of taboo. But basically, several states have issued just mandates on what needs to be done, who is considered essential and non-essential personnel, and saying that folks who are non-essential can basically need to stay home. So for those who may be a little confused about what that means, non-essential folks are going to be your retail, are going to be casinos, gyms, nightclubs, places where folk can congregate where they don't need to be, basically, are considered non-essential. Banks, hospitals, veterinarian establishments, the grocery store, the pharmacy, urgent care, these are all places that are considered to be essential, and those folks will be open for business. Most restaurants at this point are carry out only. And we all are aware of the fact, and if you don't know, the federal government has extended the deadline for taxes. So the original deadline for submitting your taxes is April 15th. It has been extended to July 15th. So these are some of the current things that are going on. And also, just as a quick note for those who like to get their drink on, liquor stores, at least in the state of Maryland, the liquor stores are staying open. You know what I mean? Which makes a lot of sense because they don't want y'all in there rioting. And I'm not going to judge or give too much because I'd probably be rioting too. I would be rioting too. So I'm not going to do that. But I just wanted to let you all know that. And some of these states are not limited to, and we all know the popular ones like New York and California, and the news about California and the Governor Newsom estimating about 56% of the population was going to come down with the virus. Whether or not, I don't know what that number was based on. The article that I read didn't have how he came up with that number, but that's what he projected. And of course, he has said that residents of the state of California just need to stay in the house. So it's not quite the Q word, but stay in the house and Q word, same thing. Connecticut is another state. They also issued basically an order starting from today, which is Monday, the 23rd of March, through April 22nd, for non-essential personnel to stay home. Of course, we're still practicing social distancing. I don't know how many of you all are actually doing that. I hope you are. But I know some of my friends in the South, in Atlanta and North Carolina, y'all still playing. And I'm just trying to warn y'all, like, y'all better tighten up. Delaware as well, Florida, Illinois, Indiana, Louisiana as well, and Maryland, as I mentioned, and several others. The Wall Street Journal has an article that basically breaks down the state-by-state guidelines, and I will include that in the description. Since the last time I recorded, the amount or the number of cases has significantly increased. You know, we know Italy is on lockdown. Iran is on quarantine as well. And even though, again, like I said, they're not quite saying it, we're kind of on the road to quarantine as well. So this is serious. There is some positive news, at least for right now. China has reported that they have no new infections since their very extreme quarantine that they implemented. So it's kind of some good news, and we're just going to continue to see how this is going to go. But I wanted to give you all a little bit more of some updated information, just for your edification. And something else that I didn't talk about in these couple of episodes, and this is the beauty of collaboration and community, knowing that you can't cover it all. The Justice Collaborative actually did a really great webinar where they discussed the implications and issues with the coronavirus as it relates to detention centers and prisons. And I will be more than happy to provide that link. And shout out to the Justice Collaborative. They had, oh man, I totally forgot her name. Oh man, Ayanna Pressley. They had Ayanna Pressley to speak as well. So it was a really great and very informative discussion. So I will include the link for that as well. So I just wanted to give you all that bit of information, and I hope you all enjoy this episode. Hello, everyone, and welcome back to another episode of The Crossroads. This is your host, Rashida Green, and this is the show for and about environmental justice and those who fight the fight with skin as melanated as the days are long. Knowledge is power, and we are breaking down stereotypes one episode at a time. So as promised, I'm doing part 2 of my discussion about the coronavirus from a social justice perspective, and my girl, Doniel, is back with me again to give her insight and perspective, being a nurse, being one of the folks who's on the front lines of this disease and pretty much healthcare in general. Doniel, thank you for being back again.
Thank you for having me. Hello, everyone.
Yes. So, girl, what is the tea? What is going on with this virus? And like, from your perspective, how terrible is it?
It is terrible, but I'm looking at all statistics in healthcare. So there's more people right now dying from heart disease than it is COVID-19. So even though this is a pandemic, the difference between the two is one is communicable and one isn't. So
that's the difference between a pandemic and an epidemic?
Well, the epidemic means it's in a smaller area and it's controlled. A pandemic means that it is worldwide. It is a global phenomenon, which is happening right now.
Okay.
So, but what I was just saying as far as heart disease, like we got, every 20 seconds, I think we have like almost 1,000 people die of heart disease every 20 minutes. Every 20 minutes, there's like 1,000 people that die from heart disease in America. Right now, our statistics, we don't even have 50 people that have died from COVID-19 in America at this particular time. So the way that it's being, I guess put out in the media, this mass hysteria, is really to drive sales, because you got big box stores closing. Sears, JCPenney's is closing, Macy's is closing. You got so many different, mom and pop stores closing, and we're up for re-election. Mr. Orange Man is running around, campaigning, trying to, get the votes. So every time we get into these situations, there is always some type of virus. So it was one time we had the H1N1 bird flu, Zika. Now we with, COVID-19. And it's a real thing, so people really do still need to pay attention. But it's always coincidental that when America is in trouble, that we get into these situations. And it's not about healthcare at all. It's really about sales. Because what do we see flying off the shelves right now?
Toilet paper,
water, Lysol, wipes, all of this stuff that is really helping mass companies producing this stuff. Is about capitalism. So that
I went I'm just tired. I just don't understand why there's so much soap and there's no toilet paper. That's the piece that just doesn't make no sense. to
And
me.
the soap, I'm shocked too because I'm like, okay, you got all of this other stuff missing, but the soap is like plentiful. I'm like, people, you talking about cleaning surfaces, cleaning this and cleaning that, but you're not even concerned about cleaning your own bodies. Your body is what
Yeah.
is carrying the virus. You know what I mean? You are actually the host as a human being. This is how the virus survives, transferred from host to host. So you would think that people will be buying antibacterial soap versus, bottles of water.
Or wine in my case.
Exactly. Batteries, toilet paper. I'm like, no, people, no, no, no. But this is, again, this is all media driven.
So, from your perspective, like, is our healthcare system built to support, the possibility of this continuing to spread? Like, do we have enough infrastructure, and not just for like healthy folks, but like the people who are actually more likely to die or contract this virus in the first place?
No. Because Mr. Orange Man likes to focus and throw money, elsewhere. So you have other countries like Austria, France that have universal health care. Anybody from any borough can walk in there, get health care, and it's free. For Americans going into a hospital, a minute clinic, or, urgent care, there are cost factors, whether you're copay or you're paying out of pocket because you're underinsured or you don't have insurance. These are the people that are going to suffer the most. Our infrastructure as far as healthcare is concerned is not built, is not capable of handling this type of situation, which is why it has continued to spread as wide as it has.
Mm-hmm.
We've known about this for 4 to 5 weeks now, and um, we've sat there and watched it go from one continent to another continent to a whole nother continent. We're not even talking about countries anymore. We're talking about whole continents being disrupted by this virus. It could have been stopped a long time ago had they taken the precautionary measures that were supposed to be implemented but weren't, because they just look at it, oh well, it's controlled. No, it's not controlled. And now that you guys have been so lax on one side, now that it's on the other side, you're not ready for it. You're not. Look, we don't even have masks. The nurses,
Oh, girl.
thank goodness, when I was putting it out before to get your mask, I did finally get masks for me and my family. But my job, my company, they don't have masks. My company doesn't have hand sanitizer.
Mm. Yeah, well, let's just thank that asshole in Texas for buying 17,000 units worth of hand sanitizer with his punk ass.
Listen,
Sorry.
yeah, he did. He definitely did. But
Punk
again,
bitch talking about, oh, I might donate it. Girl, I might go to Texas and knock your shoulders around.
exactly.
All right, I'm sorry.
But again, it's about capitalism, because you're looking on eBay and all these other sites and people are selling $1 worth of hand sanitizer like how they selling crack bottles. You know, you want this, gram of hand sanitizer, well, it's going to cost you $50.
Oh my God.
And that's just how they're doing it. It's about capitalism. It's not about protecting people's health. It's not about educating the public, the poor public. It's not about going into urban communities and really giving them the education that they need as far as, hygiene and so forth and so on. It's not about that at all. These are the people that are being preyed on. You got to remember this. Black people, namingly black people, are consumers, and they are betting on you. You know what I mean? They're betting on us. This is where they're making their profits, because they always look at the bigger scheme of things. Let's go with the people that are dumbest, the ones that don't read, the ones that are disenfranchised, and these are going to be our target. This is our target market right here. This is where we're going to make our most money. And this is why we are where we are right now, because people haven't really been educated.
And getting into that more, so I talked about this on in part one of this episode, where I was saying that, first, that what I've seen, and I'm sure you've seen too, is just a lot of disrespect being given to our elders. Like a lot of ageism, a lot of like, oh well, it's just killing the olds, who cares? They're gonna die anyway. And just a lot of disrespect in that capacity. And from like a Black perspective, I've also seen a lot of foolishness, a lot of like, oh girl, well, we can't get it because we wash our hands and we're clean. Or melanin. I talked about this too, how our melanin was supposedly preventing us from getting the virus, which has turned out not to be the truth. So it just seems like there's a lot of misinformation going around on the internet and on social media.
That's big because, we are people that, will look at something and believe it at face value. And it's wrong because Black people can get the virus. Black people can get most diseases that are coming around, on the face of this earth. But a melanin is not going to protect you. As far as the cells, I've seen a post where it was breaking it down into these cells are what's going to attract you to get the COVID-19 virus, so you got to take these herbs. No. So it's communicable, meaning that it's droplet precaution. So the only way that you can get this virus is by somebody coughing on you, coughing around you, sneezing on you, talking over your food that you then consume, and so forth and so on. But it has to be droplet precaution, meaning droplets of bodily fluid coming from the infected person to a non-infected person. So when it comes down to our elderly people, and it is a shame because I heard of a report today. Somebody was out, I'm not sure what store, but the lady sneezed, and the next thing you know, it was a big old brawl. But the lady she actually had allergies. It wasn't that she was
yeah, that's my thing.
She had allergies, and this is allergy season. It was 70 degrees one day. They got nice strong winds. The flowers are budding. The trees are budding. Bees are out right now. So yes, this is allergy season, and just because she sneezed didn't mean that she was infected. But again, the hysteria of being, if you sneeze, if you cough, you are infected.
Yeah.
And it is causing people to fight. I mean, I literally just sat there and listened to, the lady asked me, I need to find the nearest, doctor because my son's nose is broken. He sneezed and the lady turned around and punched him. And I'm like, this is crazy. This is really, really crazy. So the people that more or less are immunocompromised are those that have underlying conditions, as in COPD, any type of lung disease, any type of lymphatic disease, stasis wounds, those that are couch potatoes, people that don't move around a lot, smokers, all of those that are most at risk.
Okay.
So, how can I say, like elderly people, just because they're old does not mean that they're at risk. You have to have underlying health conditions that make you at risk.
Okay. And then, like, what is your perception about this idea of like Black folks and our hypersensitivity towards cleanliness? I mean, I can guess, and I touched on this, but from your perspective, like especially in light of some of the other things that we've heard recently, that some folk don't believe in washing their legs, or
that wasn't Black people.
No, it wasn't. And we just go, let's just go, And even some of the things that we see in our workplaces, if folks have, everybody has a break room, and we all know that there are some folk who like to cut cake using a plastic knife and like lick their fingers, things like this. And I would just be curious to know your perspective on where these sort of cultural and social differences come from, but also like Black folks and just this like very deep-seated need to advocate and demonstrate our level of and commitment to being clean?
I would suggest that people just use your black intuition, because black people listen, you know it's a real thing. So we will walk over a puddle. We will, not touch certain things.
No, we won't.
We will, turn around. Yeah, if you call for you, we're going to give you the side eye. We're going to turn around. We're going to walk away from you. Some of us will butt in line to get away from the person, two people behind us, so that way we don't have to breathe the same air. So for, a lot of people out there, I would just continue to say, no matter, how black you are, still continue. Wash your hands, wash your body, wash your face. Do what you need to do to continue to stay clean. Now, when it comes to our, protected counterparts, I would say continue to use your black intuition. Stay away from the Becky that's, licking, every page in the report before she hands it to you. I would stay away from the Becky who has to put on her makeup first, cough on her hand, pick her nose, and then open the door for you. I would look, if she, oh, can you use my computer? Can you come help me? Now you have to go and touch her keyboard. No. Now, again, we have black intuition. Some of those things we just aren't going to do. So continue, you don't have to use Clorox wipes. You can get your a washcloth and dip it in some water and bleach and sanitizes, and your workstation, your keyboard, or whatever the case may be, your mouse, and just keep it moving. But just be aware of your surroundings. Be aware of those people that may be infected, that want you to be infected, because we do have a lot of those out here too. Yes, we have a lot of those out here. They want you to be sick right along with them.
So this, when I say fighting is my love language, it is, but it is also a way of life. Like I was in, I try not to talk about my job too much because I don't want to give away where I work, but like I was in a meeting with some peoples, and like one of them is coughing and the other one is like, well, I've been out all weekend. I could just be spreading and I just remember, and I'm the only black person, and I'm just sat there and just had to keep my mouth closed because I know how my mouth is set up, and I also know how what my face gives. So I tried very diligently to keep myself together, but it's like, I just needed the ancestors in that moment to just come by and bless, because I don't have time. Like, what are you doing? There's nothing to joke about. I mean, it's bad enough I'm putting myself all the way out in harm's way going to Chipotle. But granted, though, Chipotle whole time they had hand sanitizer inside, so I felt good when I got my vegetarian bowl. Anyway, point I'm making is like I'm tired. I just like the differences. I tried to like be okay with them and all that jazz, but it's like as much as we've been told how dirty we are, how filthy we are, or whatever, as part of, just overall negative stereotyping and propaganda in this country. There's also what I think is the worst part is when you find out what the truth is.
And it's actually the reverse. It's actually the reverse. So yeah, for us, cleanliness is next to godliness. So that was something that was ingrained into our brains as kids, our grandparents, our ancestors. That was always ingrained in them. They were the ones that did all of the cooking and the cleaning. They were the one always doing the laundry. They were always the ones cleaning masses, kids, and so forth and so on. So being in the cleaning realm has always been something that we've always done. So that's actually the reverse. I think black people are some of the cleanest people because it was a profession for us. It was something that, like I said, it just became part of our DNA. We've always been clean people. Always. Yeah. And still remain to be clean people. Now, we may not have, the big fancy, rainforest showers and so forth and so on, but we know how to stand in the middle of a tub with a nice bucket of hot water to soap up and rinse off on a daily basis, right, if need be. But we don't walk around, funky and just looking, derelict. We're just not that people. We are a proud people and come from a long line of royalty. So that's not us.
Yeah, and I'm really glad that you said that, and I was trying to get into that a little bit when I had talked about this before, but that was like really a good way to put it. So, have you had any being a nurse? Have you had have you had I can speak English, any experience working with the homeless population? Like, have you had any sort of experience with that at all?
I have not, because I am corporate. We're insurance driven, so
Hmm.
I have not.
Hmm. So that means that if a person does not have insurance, that you won't necessarily help them or support them.
No, they wouldn't even have the number to actually call our company to get those types of services. So,
Wow.
yeah, you have to have some type of health insurance in order to get help. And most homeless people don't have insurance because they don't have addresses.
Right.
So you have
Yeah.
to have a physical address in order to get any type of service from the state. Any state that you live in, you have to have a physical address.
Hmm.
And that again is a shame.
Yeah.
We got veterans on the street, that serve the country. They have military ID, but because you don't have an address, you can't get services, you know what I mean? So you have an infected foot or whatever the case may be. You may have a cough, you may need an inhaler, you may need insulin. But just because you have a military ID does not mean that you're going to get services. You have to have an address. Even though the state knows who you are, even though your country knows who you are, you got to have an address.
What are some of the other barriers that you've noticed when it comes to healthcare and insurance?
Well, again, it becomes a black and white issue. A lot of times, they put everything in fine print, and you may have 5, 6, 7 pages. Whereas though you give this to a white person, they give them a number to call, and you can have them call, and they'll explain it to you. Where some black people don't even get all of that, so they're kind of like stuck. Like, okay, well, I got all this paperwork, so what do I do with this paperwork? Sometimes, instructions are not always clear. The vernacular is not always clear as to concise instructions on what you need to do to get that information. So, that's a big roadblock for certain people. Even though they, are eligible for insurance, they don't even know how to use it. They don't know that, okay, well, you can get a gym membership for half price. You got people that's been on or had insurance for a number of years and come to the end of their term and be like, I didn't even know I had a gym membership, or I didn't know I could have went and got my flu vaccine for free, or I didn't know I could have gotten, certain supplies that I needed for incontinence for free, or I didn't know that I had access to, hospice. It's a lot of things in the insurance setup that is not explained to our people.
Yeah. I and just my own personal experience with insurance, usually when depending on my stage of employment, it's always one of those things that I'm excited about, but it's never done at a time where I can really give it a lot of thought and pay a lot of attention to the fine print or the details. I'm
Right.
usually looking at the cost, like how much is this going to take out of my paycheck every month, or in addition to everything else, like the taxes or 401k or whatever. Like, how much of this do I really want to give to an insurance that I may or may not use in the course of a year, right?
Exactly. Exactly. You have a lot of that happens, especially in our community. Even when it comes to drugs, the tier of drugs, whether it's a brand name or a generic. A lot of them don't even know the difference and know that even if you need that brand, that there's actually other assistance that works along with your insurance to make sure that you get the brand name drug that you need instead of getting the generic.
Yeah. We've talked about birth control before, but I was definitely on a generic brand for a long time.
I mean, it happens. It happens. The thing is, once you know, you do better. You know what I mean? And we have to ask
Yeah.
questions. If there's certain things that we're not sure about, a lot of us, don't want to raise our hands to ask questions because we look stupid, or we think that we look stupid, or it's not cool to, look dumb. You're supposed to know everything. No. This is what it's all about, is to ask questions. Find out. If you don't know, find out. Because this is how you're going to progress, is when you get the same information and knowledge that they have.
And like, what are some things that, aside from just like asking the questions and not being afraid to stand up, like, what about those folks who, may not have a 9 to 5, maybe they're shift workers, or, working construction, or, doing landscaping or different things like that. What are some things that people can do just to be better prepared in general? Like, what I've noticed about this particular issue is, we still have the same bread and eggs problem, where people are running out buying all the damn eggs and bread and, all the paper products and things. But like, what are some things that people can do just to be better prepared first, but also to, just to be more knowledgeable about their health and their healthcare provider?
So if it's a supply issue, I would tell people during this time to get out early in the morning, especially with the 24-hour Walmarts. They do their restocking at night. So if you have to sacrifice a little bit, get up a little bit earlier. Get to Walmart at 2, 3 in the morning when all of the surplus is out and they're restocking the shelves. Don't wait until 9 and 10, in the morning, where everybody's mom and dad is up and trying to get to the store.
Right.
The next thing I would say again is to continue to, wash your hands, be aware of your surroundings. When it comes to insurance, if you don't have insurance, there's plenty of low income insurance plans that are still out here, still available. A lot of people can qualify for life events to enroll, since it's after like enrollment period. There's a number of different things that you can do, and don't be afraid to, if you don't want to physically ask or verbally ask, someone a question, you can always use Google will give you at least the first few steps that you need to get the information that is going to help you. I'm trying to think of what else. Sometimes, your next door neighbor, if they're cool, it's always nice to knock on the door and say, hey neighbor, how you doing? I just got a couple questions. If you don't mind, if you would help me, there's always, other avenues to take to get what you need, especially for black people, because we know how to black-alize. We will take the smallest of an incident and turn it into something, bigger than what it is. So we have the resources and the capability to get the knowledge that we need in certain circumstances. You're going to feed your family, but you got a loaf of bread and just one stick of butter. Trust me, we will grill that bread, we will toast that bread, we can bake that bread, we can melt that butter, we can soften it. But guess what? Everybody's going to eat, nobody's going to be hungry. So we know how to black-alize. But in this situation, I know, child. Look, improvising was for those, but for us, we've always black-alized. You give us the scraps, we're gonna make a full course meal with it. But in this situation, especially for people in our community, reach out to one another if you can. If you don't want to ask this one, ask another one. If you don't want to ask, like I said, just get online, Google. We have these phones, everybody's walking around with a cell phone. Start typing in questions, half a question, part of a question. If it's a term that you don't understand, a word or whatever, type it in, ask for the definition, and get understanding. But this is how this is how we'll move forward in this particular situation right now.
Yeah, and stop making these very hilarious videos about the coronavirus. Stop it. And
it's funny
memes.
it's
Stop
funny.
it.
It's,
It is
it's
funny.
full of a lot of misinformation for those of us that don't think for ourselves. Will take that humorous information and really believe it. So for some people, yeah, it could be funny, and we know, what to chew and what to spit out. But certain other ones, they swallow, and we can't afford that right now. We really can't, because
Yeah.
you got black people out here thinking, because I'm black, I can't get this virus. And I'm like, okay, you keep thinking that.
You playing yourself.
Hey, listen, we went through this back in the 80s and the 90s when it came to, AIDS and HIV. Oh, well, black
Come
people,
on.
only straight people, are going to be immune to this. Okay, you keep believing that. Statistics
Yeah.
have proved you wrong several times, again and again. You have to be self aware and know that, in certain cases, yeah, it does become survival of the fittest. The more you know, the better you do.
Right. And I'm glad you brought that up because there's, a lot of healthcare issues that have arisen in the past. We really have to lean in on those and be aware and knowledgeable about our history and just history in general to help us kind of, not even just kind of, but help us to avoid these things. Like in the first episode, I gave flowers to Henrietta Lacks, and I know you know who she is.
Yes, I do.
And, and it's like she is one of, unfortunately, a few well-known cases of a person whose body and was used for medical experimentation, and we saw that again with the Tuskegee Airmen. There's in many black communities across the street from a housing project is some form of hospital, but usually it's just, a place for where hysterectomies have been performed or just medical practices against the knowledge or consent of the patients.
We're seeing it
Right.
in Flint with the water. That's an experiment.
Oh, girl.
Listen, is no way in the world in that type of infrastructure with Flint after everything that you just named. Now we're talking about lead poisoning, water poisoning. You know what I mean? That's
Yeah.
biological warfare. But if you
Yeah.
look at the area, and you look at the population and you see who's there, the majority of the people are black. They are black.
Yeah.
And they're raising children and trying to, get by and doing the best that they can. The economy over there is not good. But we're talking about replacing pipes. You took pipes that were perfectly normal, but they were aging, and replaced them with piping that is leaking lead into the water. So the
Right.
solution is you go take those pipes out and replace them with pipes that don't. Why hasn't that been done?
I li- I don't know. I don't know. It's just and that is one of the most frustrating things. But again, this is not the first time. This is not the first time that we've had an issue with lead poisoning, unfortunately. And black kids are disproportionately more affected by lead poisoning than white kids.
Yes, of course. But again, if we knew who we were as a people, if we knew who we were as a people, we would not allow certain things to happen in our communities. It just wouldn't happen. But we are a lost people. We are very lost. We're stiff necked, and we don't want to hear the truth a lot of times, and we don't care to find out who we are as a people. We don't want to reach back to find out where we came from. You know what I mean? We just take what's in front of us and we just run with it. And it's not right. But this is going to go on for a certain period of time before it comes to an end, because everything has to come to an end. But we are in the situation that we are as a community because I say it over and over again, because we don't know who we are. And again, you look at some of the black communities and stuff like that, and we have all types of businesses going on, but the majority of them are not owned by black people. When you in a black neighborhood, you got Asians coming in making soul food. It's like, wait a minute. You got other nationalities coming in and creating the clothing that we wear. You got other nationalities coming in and dictating how we're supposed to wear our hair and supplying us with the hair and the lashes and the this, that, and everything else. And all of this stuff is all being done, but the black people aren't getting nothing out of it. Nothing out of it. So until we really sit down and figure out who we are as a people, this stuff is going to continue to go on. When we find out, and then we can collect ourselves and go back to, having more unity, that's when we'll be able to put a foot down and stop some of the stuff that's going on in our communities. Now these beer distributors will be black owned. The Chinese restaurant will be a soul restaurant, or a black owned vegan restaurant. Um,
Yes.
our gas stations will be black owned. Our banking, our teachers, will be black owned. Because there's no way in the world you keep indoctrinating our black kids with a system that was not set up for us.
Yeah. It was not set up for us to prosper.
This is, even when it comes into the healthcare, we got more white nurses than we do black nurses. And I'm like, I would think that it would be evening out at some point, but these kids don't even know anything about nursing or healthcare. They want to become Cardi B, or they want to become, the next real Hollywood wife, or whatever the case may be. That's what their
Real
ambitions
Housewife
and
of
goals
Atlanta.
are, because that's what they're being fed.
Oh, Lord.
I mean, that's a
Yeah,
whole nother topic, but
it is.
I'm telling you, it is sometimes from the mouths of babes that can change a whole situation. When my granddaughter came up to me and said, "Mimi, you're not supposed to be eating those gummy bears." I had to look at her like,
Why?
"Child, I bought these gummy bears. I can eat whatever gummy bear I want." But then when I was thinking about it, she knows that I'm not supposed to be eating this sugar like this. She knows that.
Yeah.
So I had to sit back and look at her. I didn't chastise her or anything. I said, well, you know what? She's right. So she was like, here, Mimi, I'm young. I can eat those gummy bears like that. I
That was a setup. She just wanted the gummy bears for herself.
set up and I said, nope, I'm going to just throw them in the trash. I gave her one. I had the last one and I put the rest of them in the trash. I said, Mimi's not going to buy those gummy bears like that anymore. But you are absolutely right. So, but she was speaking because she knew hears me talk about health and being at a certain weight, being toned, being fit, having my body prepared and ready for certain things. When if a virus like this comes along, am I prepared? Is my body ready for something like this if I had to come into it? Because I'm out here in the field dealing with people who are infected and some that aren't. Is my body ready for
Mm-hmm.
this? So I had to keep myself ready, and she was helping me realize, maybe you had to be ready for this. You on the front lines. And she
Mm-hmm.
was absolutely right. So I had to make a change and did what was right in her eyes and in my eyes, so that way I could be protected also.
So, like, let's, I know, we've already come to the crossroads, but, what are some things that people, in a quick recap, what can people do for their physical health to keep themselves, aside from washing their hands, aside from washing your body and cleaning your doorknobs and all those things? What else can people do to, like, physically? Are there any homeopathic things that people can take or do to help themselves keep their immune systems high and functioning?
Yes, so vitamin C is one. So vitamin C is our immune booster. Um, that is going to help a lot. I would also say work out, and still with the vitamin C is also a tissue builder. So as you're working out, you take a day of rest after you worked out so many days. That tissue builder from the vitamin C is going to help build muscle. The more muscle you have, the more immune to certain diseases you become. The more fat you have, the more susceptible to disease you become. So people that have more muscle mass, their body pH is more on the alkaline side. The people that have more fat, their body pH is more on the acidic side. Anytime your body is in the acidic side, you're no longer in homeostasis. Acid causes disease. Acid follows disease. Fungus follows disease. Sugar follows disease. So you don't want to be on the acidic side of the pH scale when it comes to keeping your body physically fit. When it comes into disease and viruses, as we are talking right now with this COVID-19. The other thing
Mm-hmm.
is they're talking about social distancing. Social distancing is good because you don't know who's infected. Nobody is standing at the corner passing out, COVID-19 test kits. So, and again, we're on short supply of those. Thank you, Mr. Orange Man. But
Mm-hmm.
nobody is handing out those test kits. So social distancing is also another good practice with people that don't, live immediately within your household. um, Echinacea, golden seal, elderberry, all of those things are excellent when it comes to the immune system and helping your cells be healthy, helping you be in a homeostasis status. So that way your body is able to, if you happen to get the disease, if you happen to become infected, this will help to lessen your symptoms. Those symptoms are almost like the flu, so mostly is the cough and the high fever. So with the flu, there's a little bit more symptoms that go along with it. But if you happen to experience, the runny nose or nasal discharge, those are some of the symptoms that will go hand in hand between COVID-19 and the flu. So I would just continue to take those vitamins, work out, eat healthy, put away the meat. Don't eat the meat.
Aha!
Is acid. Dairy products.
Meat is murder.
Look, dairy products are pus, animal pus. Just like us, as being humans, when we are breastfeeding our babies, our mammary glands get rid of waste. So that waste product does contain some nutrients for our babies to grow, but this is human milk. So when you start looking at consuming, animal milk, such as, cow pus, that's not benefiting you. That is keeping you in an acidic state. That type of milk causes mucus, and mucus causes acid. So if you want to keep your bodies healthy, stay away from that stuff. Totally.
I wish you could see the face I'm making. Ugh. And I love dairy, but I'm lactose intolerant. I cannot do it.
And there's a reason why you're lactose intolerant, because that is biofeedback. That is your body telling you, I don't want this. This is not good for me. I don't know why you keep bringing this over here. If you keep doing it, watch what I'm going to do to you. And next thing you know, you got bubble guts and everything else. It's like, see, I told you. Now do it again and watch me do it all over. And then next thing you know, you go get that ice cream and
you're pooping in a bag. Yeah.
So that's biofeedback. That is your body letting you know that this is not good for you.
Ugh. That breaks my damn heart. It really does. I miss dairy so much. I do. I miss it.
But we have so many dairy alternatives that are, beneficial for your body. Because this is your temple. This is your armor. This is where your fighting machine right here. So you have to take care of that. It has to be in tip-top shape and ready to, be ready for battle at any time. So
you're right.
Yeah, stay away from the pus. Pus is not good. Look, you have to tune into what's her name, Dr. Pimple Popper, and see some of the pus.
I love her.
I do too. I do too. But I ain't eating that stuff. I don't want to lick it.
Ew.
I'm not trying to slurp it.
They actually make
slurp it through a straw.
Ew. They actually make cupcakes that are like in the shapes of
pimples.
Lymphomas and and pimples and stuff. It's real gross looking.
Yeah, but that's not what we want. Yes, we want to keep our bodies in tip-top shape so that way we can get through this. We got like everything is on lockdown for 14 days, but we have to allow another 14 days just to make sure that the numbers are dropping. So, again, you want to be in an alkaline state. You don't want to be acidic.
Thank you so much. I really, every time, this is the second time, but this is not the second time that we've talked. And every time I talk to you, I always learn so much. And I appreciate you taking the time, because I know that you are busy, and, just to come on the show and just drop some gems and drop some knowledge. And I just appreciate you so much. I really do.
I appreciate you having me. I know tonight was a long night for me. I've been, like I said earlier, triaging, phone calls coming in for COVID-19 all day long. I'm worn out. I worked longer than I should have. I know sometimes it may seem like I'm rambling or I'm reaching for a word, but that's because I'm like almost on mental shutdown.
Yeah.
Almost on mental shutdown. Everything has to reset at some time. So
Yeah.
it is, yes, it is my reset time.
So I will not keep you any longer. And do you want to plug anything really quickly before we go?
Sure. My name's Doniel, and I am the owner of DNH Organic Hair Care, which is a food-based hair care product. And you can reach us at DNH Organic Hair Care on Instagram and Facebook. If you'd like to place an order, our distributor is homeswholesale.com, and you can order on that site.
All right. Thank you, Doniel, for joining me, and thank you, everyone, for listening. And we will see you at the crossroads.